should we or should we not do CPR, resuscitation, in a patient in whom you're suspecting COVID within the hospital? I think that's it's a very it's a question that has been plaguing all of us as healthcare providers. Like when we have a patient with COVID, we talk about restricting the the providers within the room while resuscitation. Everybody will volunteer to be outside the room. so so I think I'll have a view from all of the faculty members. So what do you think? When do you resuscitate? Or do we need to take a call on this? Because I'll leave it open to discussion. I think we'll start with Dr. Ravi Kumar sir, because you are the first person who
Yes.
started off.
Yeah, I think a philosophic as well as an ethical answer is yes, we should. I do not think we can say that we will not resuscitate this patient. The only exception to that would be not in the patient who's just cardiac arrest, but somebody who's an extremist, terminal stage in the ICU, already not being able to be out. Already you have tried everything. The end result would be almost inevitably the patient is not going to make it. At that time, we need to make an ethical decision in concert with the family or with the administration whether we should do not resuscitate. So that has been a dialogue still evolving, but there you can make an exception. But beyond that, I think we should resuscitate. In terms of how do you protect, I mentioned to you already, as a healthcare provider, as a nation, as a global system, we should protect our frontline people. We should give the adequate PPE. Don't tell them you should go and resuscitate without giving the PPE. So as long as you give the adequate PPE, everybody should be resuscitated, except in a terminal stage patient will not make it. He's not able to be on, not able to oxygenate, his cardiac condition is gone. Then you don't put oxygenate, his cardiac condition is gone. Then you don't put that 20 minutes of extra effort to aerosolization, everything, and put the risk of the healthcare provider. So that is one. The second thing is, you asked the earlier question that relates to that, and people are already in some hospitals I hear, both in US and here, they are putting on COVID call all the time, and somebody doesn't take the COVID call. That is not also ethical. So when there is going to be a shared gain, there will be a shared pain. So people are now doing the rotational things in that is a rational thing. So everybody should take turn. And whether you will have a COVID resuscitation team or non-COVID team will depending on how many COVID calls you get. And I was in one of my hospitals in Brooklyn. You must have seen in the New York in CNN. There's one of the hospitals I used to work, and they were getting 5 calls, COVID calls every few minutes when they were talking, the intensivists. So in that sense, if you have a non-COVID code blue team, that has to pitch in to help the COVID team. They can't say, I'm not a COVID team. The COVID team has 5 resuscitation going on at the same time. I will not go. So these are all the nuances that we need to work with. And you already mentioned about restricting the number of people, whether you're going to have 3 person, 4 person inside, others can be outside. The person who's running the code can be outside and doing the code in the ICU. And the person who's a recorder can be outside also. That person doesn't need to be there. You probably will need minimum of 3 persons or 4 persons around the patient being resuscitated. That's my answer.